Hello, this is Dr. Gay from First Look MRI, and this is a 49-year-old female with complaints of shoulder pain for about 2 weeks. She had an injury, and now her shoulder feels unstable and terrible pain. And we can see on this view something bad is happening. This is the humeral head, this round ball. This is the deltoid muscle outside of that, which is gray. This is the dark subcutaneous fat wrapping around. And we see this long bone here. This is the scapula. There's a muscle in front, muscle in back. And this is part of the rotator cuff musculature, the rotator cuff muscle here in the front that attaches to the front, and the rotator cuff muscle that attaches to the back has a problem. We have this big dark glob. So the question is, what is this glob? We see also fluid here. This is where the posterior rotator cuff should be, so there's fluid-filled gap. So they have a tear, ruptured posterior rotator cuff, plus this glob of darkness here. And this turns out to be calcification we can see on x-ray. And so it is possible that they dislocated their shoulder posteriorly with that injury, and their shoulder has been driven backwards, and then they tore the back of this rotator cuff and it peeled back to here, and then this darkness may be dystrophic calcification. Just when you have a tear of a tendon or a muscle, you can get bleeding into it, and you can get ossification eventually. The injury is only 2 weeks ago, so that doesn't make sense. That process should take a lot longer. So they could even have something called calcific tendonitis that would look a lot like this, but it would just be incidental. It wouldn't be related to the injury. This could be calcific tendonitis they've had for a long time, and they just happen to have that plus this torn, retracted posterior rotator cuff. But the bottom line is a big chunk of calcification, a torn posterior rotator cuff with fluid-filled gap, and maybe a little scalloped area here. Maybe this is a bone fragment that got peeled off here before, or periosteal fragment. If they've had a real old injury they weren't remembering. And we can see this epicenter of the humeral head. This is the humeral articular surface. This is the epicenter of the middle, and this epicenter should be right here in the epicenter of the glenoid. So we can see the distance. Instead of here, this should be way up here. So this is subluxed backwards a lot. So it's a very unstable shoulder with the humeral head just sagging way backwards, related to a tear of this posterior joint capsule and posterior rotator cuff. So very severe injury. Also their labrum rather. The labrum is a little dark triangular fibrocartilaginous band that goes around the rim of this cup here, and the labrum is torn. We see the back okay, but the front has bright signal within it. There's a linear band that goes underneath the labrum and even into the articular cartilage. On this tangential view, this is called a coronal view. We're looking straight at the shoulder, and we see a couple other things. We see that the superior labrum here, there's a brightness underneath it, so there's a tear of the superior labrum as well. The labrum is very hard to evaluate, but this patient has a tear of their superior and anterior labrum, and associated with that tear, there's a little bright spot, a little lobulated fluid collection. We see fluid is white here, so we see white fluid in the joint. We see white fluid over here. So this is what we call a paralabral cyst. This labral tear had fluid leak out of it, and the fluid leaked over here, and it filled into a little pocket here called a paralabral cyst. If we go in this view, we'll be able to see that. And the labral tear is back here, and the fluid is leaked backwards around the glenoid and filling up the space here. This is called the spinoglenoid notch. And that little bright fluid collection is that fluid that's dissected back, and then it went to an area here with low resistance and filled up this little pocket. And this can compress nerves back here and cause pain and atrophy of muscles. And we don't see that atrophy yet, but this is again a cyst of the spinal glenoid notch, which is called you can have a ganglion cyst, but in this case they have a labral tear, so this is much more likely a paralabral cyst coming up and over. It can be really hard to see the communication sometimes, but if you have the cyst and you have the tear of the labrum, and you see a little foggy trail of gray, you know that, yep, this is a paralabral cyst, almost for sure, rather than a ganglion cyst. And again, if we had a totally normal shoulder joint, and we saw this all by itself, we might say, oh, maybe this is just a ganglion cyst in there, but this is called a paralabral cyst, and they can look identical. One more thing, this patient, this is their top of the rotator cuff that goes over the top of the humeral head, attaches over here. This is very bright. So this is tendinopathy, irritation, partial intrasubstance tearing of this. So it's not ruptured, just has some abnormal signal within it. And that's it. So a complicated case of probably a posterior shoulder dislocation where they've had an injury of or a tear of the posterior rotator cuff. There's a big chunk of calcification that could be related to calcific tendonitis or an avulsion injury of the bone or of the overlying periosteum, and also some edema in the posterior rotator cuff muscles. This could be recent, plus that labral tear and paralabral cyst. So the orthopedic surgeon is going to have their hands full. And that's it. Thank you very much.